Hi, it's Patrick Hutzel from intensivecarehotline.com with another episode of Your Questions Answered. In this week's episode, I want to explain how long is a patient kept on a BIPAP machine in intensive care. This is again a topic and a question that many readers want to know more about. So if your critically ill loved one has been admitted to intensive care and your critically ill loved one requires a BIPAP machine, which in essence is intermittent ventilation with a mask on their face, your critically ill loved one is well enough to not breathe with a breathing tube in their throat, which in essence is continuous ventilation. If your loved one in intensive care requires BIPAP or mask ventilation, he or she can have a break from the ventilator and go back on an oxygen mask or on nasal oxygen, at least for a while. Again, the main difference between BIPAP or mask ventilation is that your critically ill loved one is not fully ventilator dependent and only requires the mask or BIPAP ventilation intermittently. So how long can your critically ill loved ones then stay on a BIPAP machine or on mask ventilation? The answer is that it depends. In theory, your critically ill loved one could stay on the BIPAP machine indefinitely. However, BIPAP or mask ventilation should be a means to an end, which means that it should be used and is mainly used as a temporary form of ventilation or respiratory therapy until your critically ill loved one is well enough to breathe by themselves without the mask or the BIPAP. Usually, in intensive care, several things might lead to BIPAP or mask ventilation. Number 1. After extubation, removal of the breathing tube, your loved one might still need some intermittent support for their breathing, as they are not quite strong enough to completely breathe on their own. The BIPAP or mask ventilation is often used to inflate collapsed parts of the lung and therefore helps with oxygenation and also helps with preventing pneumonia or an infection on the chest. If your critically ill loved one has been admitted to intensive care for a respiratory condition such as pneumonia, asthma, COPD, etc., and still has reserves to breathe by him or herself, the BIPAP or mask ventilation might help your loved one to stay away from the tube and therefore continuous ventilation, which would also require your loved one to go into an induced coma. Sometimes BIPAP or mask ventilation can be used in end-of-life or palliative situations as well. The biggest challenge with BIPAP or mask ventilation is that it is extremely uncomfortable and many critically ill patients are unable to tolerate it for too long, often leading to exhaustion. Depending on your critically ill loved one's overall condition, he or she may not have the reserves to stay on BIPAP or mask ventilation for too long and therefore requires intubation and tube ventilation in an induced coma. Usage for the right patient in intensive care can be extremely effective as well, and avoidance of tube ventilation in an induced coma can be achieved. In theory, BIPAP or mask ventilation can be used indefinitely. However, the reality for critically ill patients in intensive care is that if BIPAP or mask ventilation is required for too long, it gets very tiring and exhausting, and it often leads to mechanical tube ventilation with an induced coma. For more information and for more in-depth insight that you must know whilst your loved one is critically ill or is dying in intensive care, sign up for your free membership and download your free Instant Impact Report below. In the free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In this free report, you'll also discover how to ask the doctors and the nurses the right questions, how to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. 5 killer tips and strategies helping you to get on the right path to control, power and influence in your situation. You will get behind the scenes insight so that you know and understand what is really happening. How you need to manage doctors and nurses in intensive care, and it's not what you think. With your free Instant Impact report, you'll also get 4 other free reports, and the reports you will be receiving are: the 6 questions you need to ask the most senior doctor in intensive care, 10 things you didn't know doctors and nurses are talking about while you're not at the bedside with your loved one, the 7 answers to the 7 most frequently asked questions if your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Thank you for tuning into this week's episode of Your Questions Answered, and I'll see you again in another update next week. Make sure you also check out our blog section and send me an email to support@intensivecarehotline.com and send me your questions. Thank you for watching, and this is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week with another update.